warahmatullahi wabarakatuh. The article this week titled as Internal Resorption, a retrospective CBCT analysis of 50 cases with outcome assessment was conducted by Deluca et al. And published in the International Endodontic Journal in 2026. Internal resorption is an uncommon pathological process characterized by progressive destruction of dentine from inside the root canal system due to clastic cell activity. If untreated, the lesion might expanding, resulting in perforation, weakening of the tooth structure, and eventually tooth loss. The author stated that there is insufficient information regarding the radiographic characteristics of internal resorption lesions, prognostic factors affecting treatment outcomes, and long-term survival and success rate. So, the primary aim of this study was to identify factors associated with the treatment outcomes of internal resorption. In addition, the secondary aim was to characterize the clinical and CBCT radiographic features of internal resorption lesions for the materials and methods. This study was designed as a retrospective CBCT observational study conducted at Tufts University School of Dental Medicine between 2010 and 2025. The inclusion criteria requiring a diagnosis of internal resorption with availability of at least one pre-apical radiograph and CBCT scan of involved tooth. Initially, 158 charts were reviewed. However, only 50 teeth from 50 patients met the inclusion criteria. Cases with external resorption missing CBCT scans or cases not evaluated in endodontic clinic were excluded from the study. For CBCT assessment, two endodontists independently evaluated lesion location within the coronal middle or apical third, lesion size and dimensions, size of perforation, and presence of pre-apical radiolocity. Regarding outcome assessment, they evaluated both survival and success outcomes. Survival was defined as the tooth remaining present and functional, while success required absence of symptoms, normal percussion and palpation, no additional treatment needed, and no radiographic signs of pathology. Follow-up assessments were performed at 1, 5, and 7-year intervals. For the results, the most commonly affected tooth group were anterior teeth and molars, each representing 46% of the sample. Regarding lesion characteristics, the apical third was the most common location of internal resorption lesions, accounting for 64% of cases, followed by middle third at 22% and the coronal third at 14%. The study also classified the type of internal resorption identified in the sample. The vast majority of the lesion, approximately 98%, were internal inflammatory resorption, while only one case, around 2%, was classified as internal replacement resorption. For the lesion size, large lesions greater than 3 mm represented 46% of the cases, medium lesion between 2 and 3 mm represented 40%, and small lesions less than 2 mm accounted for 14%. Perforation was present in 36% of cases. Pre-apical lesions were observed in 78% of the teeth. Regarding bulbal diagnosis, bulb necrosis was the most common diagnosis at 50%. In terms of treatment modalities, conventional root canal treatment was the most commonly performed procedure at 64%. For perforating lesion, the repair material, including gutta percha with zinc oxide genol sealer, gutta percha with bioceramic sealer, MTA, and endosequence root repair material, larger perforation were commonly managed using bioceramic materials such as MTA. Regarding the treatment outcomes, the 1-year survival rate was 88%, while the 1-year success rate was 83%. However, long-term outcome showed slight reduction over the time. At 5 years, the survival rate was 78% and the success rate over 70%, while at 7 years, survival was 72% and the success rate was 70%. The study also identified the several prognostic factors associated with the failure. Teeth diagnosed with normal pulp show significantly worse outcome, and also the teeth with normal apical tissue were more likely to fail. Female patients also demonstrated significantly higher failure rate at 1 year. So, several important limitations in this study. First, The retrospective study design might introduce bias and limit control over data collection. In addition, the sample size was relatively small, with only 50 cases included, which is partly related to the low prevalence of internal resorption clinically. The study also relied on the patient records, and therefore some cases had incomplete clinical documentation and missing long-term follow-up information. Furthermore, different treatment modalities were performed among patients, which may have affected the outcome assessment. In conclusion, this study demonstrated that internal resorption lesions were most commonly large in size and predominantly located in the apical third of the root. The teeth most frequently affected were first molars and maxillary central incisors. Also, the findings also showed that modern endodontic treatment can achieve favorable outcomes even in perforating internal resorption lesions. Although the short-term prognosis was generally favorable, long-term success rate shows slight decrease over the time. And thank you.